The webinar that you're about to see will give you tools to reopen your practice. We've all gone through a period of fear, of retreat, of a forced shutdown. We are not just concerned about our businesses. We are not in business. We are in practice. We have patients who have depended on us for years, and all of a sudden they are told that their needs are non-essential, that the treatment that we do is non-essential. Nothing is further from the truth. Most in this webinar are periodontists. Other specialists are also here. There may be some general dentists as well. That's fine. We are all in this together. The fact that we've been unable to treat our patients, to give them the benefit of our diagnosis, of our treatment plans, of our thinking, and of our concern for them gives us the most pain.
But it goes further than that, because fear has been inserted into the profession that already handles fear. Now it's a double fear: fear of dentistry and fear of being in the dental office. We have to handle that new fear proactively. And then there is our staff. Our staff who trust us now has fear as they've been bombarded with news reports from media outlets and from social media. They are afraid to be in the very office where they make their livelihood. Add to that the unprecedented unemployment figure combined with new behaviors that we need to adapt, and it will be a new practice that we will need to return to.
Are we painting a picture that you've already thought about? Are you concerned that there may be no way out, that the recovery is going to be difficult? It doesn't have to be. As long as we make the correct moves now, we can guide our practices to recovery. The new normal does not have to be bizarre, does not need to be a deviation. The new normal can be rejuvenation.
But here is what you need to do. You need to be willing to discard old, dated thoughts with ideas that are new, that work, and that will prepare you for the remainder of your life and practice. If you do that, you will succeed. If you fail to do that, then you may later discover that your choice will be even harder to recover from. I want you to close every window on your computer. Put your phone down. Pay attention to only what we are saying. Get some paper and a pen and make some notes. I assure you that your time will be well spent.
Let's look first at what our staff expects. Our staff knows full well the environment in a periodontal practice. They've had to clean up after us. They know what's on the walls and floor after treatment. It may have been acceptable to them in the past. After all, we were using universal precautions that were written 34 years ago. They now feel, rightly or wrongly, that those precautions are not enough.
Do not try to skate by this statement. Our staff needs to be comfortable, needs to know that they are watched out for them, and that we are making changes that make the dental environment safer for them. Masks, face shields, disposable or washable gowns that are changed between patients, keeping office clothes in the office washed by us or laundry service are the basics. Frequent hand washing both by staff and patients, complete outerwear changes between patients, and scrubbing and disinfecting protocols based on the best information that we can get will now be the new standard of care. Adding antiviral rinses, extra oral aerosol evacuation, even UVC lights will add to the confidence that our staff has in the dental environment. Our staff will recover their confidence in being in our offices, and that will translate to increased patient confidence.
When we put our plan into action, we let everyone know. Our staff, our patients, our referral sources. We do that with videos, with emails, with posters, with flyers at the front desk. This is the most important public relations action that we can do. We have been saying stay safe for almost 2 months. Now we show those who depend on us how we're making our offices safe.
We create checklists for cleanliness. On those checklists, we define every item that needs to be cleaned on an hourly basis, including doorknobs inside and out, pens, writing areas, keyboards, coffee machines, refrigerators, reception room chairs. Those checklists are assigned to individuals in your office. Those checklists are turned into your office manager every day. The office manager checks for thoroughness and timeliness on those checklists, and we tell patients about those checklists too.
If you have run your practice without checklists up to now, please start them. The last thing you want is a government entity forcing you to do what you should be doing already. And if you create those checklists, create that new standard for cleanliness, your patients will tell others. And those others will come to you. Your cleanliness will be your most inexpensive marketing plan.
Your patients will be asking questions of your staff. How they answer those questions makes every difference in your speedy recovery. There's only one way to accomplish this effectively. You create a question in an answer sheet. You write the questions and the answers to those questions. And then you drill those questions and answers with every staff member. Each staff member can twin up and coach his or her twin on each of the answers. The answers have to sound believable before that staff member is checked off on that question. And if the staff member is asked a question by a patient that is not on the list, the staff member writes that question down, gives it to the doctor, and the doctor adds that question and the answer to that question to the list. And the entire staff drills that question. It's the perfect staff meeting to have before you see your first patient.
So let's talk about marketing. Marketing is a science and an art, just as dentistry is. Nearly every doctor on this webinar knows that we have worked with a tested method to successfully market your periodontal practice to patients. You don't have to wait for the referral source to market for you and refer patients to you. Particularly now when confidence is down, referrals may be down as well. And if you found referrals to be a slowly diminishing source of new patients, do you think that trend will not continue after the pandemic? You can market yourself. You can attract the new patient to you first. And when you do that, you have a new feeling of control over your practice. You need to do something about it unless you plan to work for another practice that will do the marketing for you. A single practitioner referral practice will be the exception, not the rule. If you saw the trend before the virus struck, now is the time to learn to expand your practice.
The method of finding those patients and gaining treatment acceptance from those patients has already been well established by the IDS. The IDS is a system. You can plug into that system, see fantastic patients, do more perio than you did before, and refer those patients to superb restorative dentists. If it were only marketing, then there would be no reason for the IDS. The patient who is marketed to is different from the referred patient. That patient has lost confidence in dentistry. He or she is looking for a way back. Your phone scheduler must be trained to work with that patient. Give the patient the full understanding necessary to reassure that patient that he or she has chosen the right doctor. That is the first step of an 8-step program to acceptance of treatment.
The value of that treatment is 3 times the value of the referred patient. And that includes periodontal treatment and implants only. Every one of those patients needs restorative dentistry. And now that you've achieved treatment acceptance, you may refer to the top restorative dentists in your area.
Is your practice fat or is your practice lean? Your practice is fat if you are spending more than 25% of your revenue on staff salaries and benefits. The fewer systems you have in place, the more your staff waste valuable time. Every part of your office needs to be on a system. Thinking one's way through means that there is no system. Every part of your office should be on automatic, on systems.
Non-system thinking is reserved for special problems. And if those special problems are occurring again and again, then you make the solution to that problem into a system as well. What's a system? It's a stepwise program to get something done. It's put on a checklist. Your staff member does step 1 through step 8, and the problem is solved.
The more systems you have in place, the more the staff plugs into those systems. You have less waste, more productivity, more income for yourself, and happier staff members. When your income goes up, your salary percentages go down.
And if you're holding on to a non-productive staff member, why are you doing it to yourself? Tell the staff member what you want. Have her create the system to do it, and she stays. If not, she goes, and you find a staff member who is willing to create a system and do it.
How else do you go lean? By reducing inventory in your office. You can get any supply item that you need in 1 week. Make it a point to keep your inventory low. That way, if you decide to buy a new product to replace an old one, you can do it fast. You don't have to use up or throw out materials that are just taking space, or worse, will expire.
You go lean by joining buying clubs that your supplier sponsors or that your dental society sponsors. You also go lean by charging the patient for the materials that you use. And today, every patient will understand that you have a treatment fee and a PPE fee. What about treatment? If you didn't see Dr. Danny Melker's lecture last week, you must see it. Go to directorofdentistry.com/learn. All of us need to create systems for saving teeth. When implants came out in 1982, they were the new treatment on the block. Now, almost 40 years later, we know the downsides to dental implants. Implants are good, but not as perfect as we thought they were. You know that, and some patients now know that. More patients are learning that. You are in a specialty that saves teeth, but many of us were never taught the science and art of saving teeth. Whether it is using oral DNA or microscopic analysis of periodontal bacteria, and then treating the teeth based on that analysis, or saving broken teeth with biologic reshaping, we can save many more teeth than we think. And by doing so, we create a market niche for ourselves. This is the true differentiation that we have as periodontists, and it is a marketable skill.
Particularly at a time when so much emphasis is being placed by the media on health, your concern about the health of your patient and its relationship to periodontal health fits in perfectly.
You can become a director of dentistry. It may require treatment planning skills you may have abandoned or that you may have never learned. Your patients will be your patients. You can and will create a full treatment plan for that patient. You don't do that now, that's fine. It's a skill that you can learn. And within a few short months, you then treatment plan the full case for the patient.
The patient relies on you for guidance, not just in perio and implants, but in restorative dentistry as well. And as you work with the best restorative dentists in town, your restorative treatment planning improves as your relationship grows with the restorative dentist to whom you refer. Treatment planning sessions are an integral part of the IDS.
Chances are that during this crisis, you called your patients. Let me ask you a question. How happy were they to receive your call? And if they were happy, and every doctor that I've talked to said that their patients were thrilled, isn't that a process you should continue? Call every new patient before he or she arrives at the office for that new patient visit. There isn't a better wow factor than that.
Take advantage of your communication systems within your software. Send your post-coronavirus action plan to every one of the patients on your list. It will cost nothing. It will mean everything. Add those communications with stories about your successful outcomes, how lives were changed, how you saved teeth that were slated for extraction, and you become the expert on saving teeth in your community.
There is a method to get these plans in place, to receive the most current strategies, successful actions, and coaching to get your practice where you want it to be. And that is by joining the Institute for Dental Specialists. Members of the IDS received continual member updates through the crisis to help them through the crisis. We are in regular contact with top performers in and out of dentistry. And because of our network, members of the IDS received the tactics that they needed for loans, for equipment, for materials, and for strategies. One manufacturer reduced the price of an expensive piece of extraoral suction equipment by $500 for IDS members. The IDS will continue to provide these time-sensitive advisories until we are back to normal again.
But even before the crisis, IDS members took advantage of the money and time-saving strategies that we receive every month with 2 half-hour video podcasts, a weekly 2-minute audio tip that arrives every Monday morning, and a library of over 120 lessons that cover every area of your practice: marketing, public relations, organization, staff motivation, checklists, communication tools, a professionally done phone training course, keys to treatment acceptance, and treatment planning sessions. You literally have an organized training library for your staff and for yourself, all on checklist. Add that to unlimited email support from the IDS staff, and you truly have a complete in-house training program for you and your entire team.
For $297 a month, all of these programs are yours. Stay as long as you'd like. Most of our members stay with us, but that's up to you. But you don't have to spend a dime right now. All of us are short on cash. New members can try us out for 2 months at no charge. You'll have access to the entire program. You'll receive every member update. And for those who join tonight, we'll send you all 30 of the COVID-19 member updates so you don't miss a thing.
There will be only one time that you will restart your practice, and that will happen in a few days or maybe a few weeks. You now have the opportunity to study a tested program that's been present for almost 6 years, listened to and emulated by some of the top practices in the country. And it's coming from people just like you in active practice, seeing the same thing that you are seeing, using a mirror and a probe just as you are.
And as we arrive at the new normal, we'll find more strategies that will work in this unprecedented time. There is a reason that we have spoken twice at the AAP, twice to the Seattle Study Club, and twice to NASP, as well as state and regional organizations all over the country.
But the important point is you. You need to recover. You may need to change, maybe a little, maybe a lot. And because we consult with periodontists all over the country and have seen firsthand how they practice and have improved their practices, we know that you are facing as well. There is only one organization, the IDS, that is dedicated to perio with the tools to make your dreams come true. And for only a limited time, you have a 60-day free trial to find out how the IDS can help you.
Now is the right time to make a decision. In fact, if you don't make a decision, that's a decision as well. The stakes are too high to go this alone. Get the help you need right now from the IDS. The opportunity is there. Go to directorofdentistry.com/membership and claim your 60-day free trial membership. Within 24 hours, you'll have all of the member updates, and you'll receive a video orientation to the IDS library. Then you'll receive training podcasts, the Monday Morning Minute, and personal email support provided by Danyel and me. This is the time to take action. Take advantage of this limited time offer to reopen your practice with a bang. Go to directorofdentistry.com/membership right now and become a member of the IDS.
You'll have only one opportunity to restart your practice. There will be a right way and there will be the other way. Choose the right way that has already been created and tested for the periodontal practice, created and tested for you. All you have to do is plug into the IDS system, a system that has been created for the periodontal practice and is tested in a high-producing practice for many years. It's tested in practices, startup and established, urban and suburban, all over the country.
You can go it alone, or you can do it with a tested system of support. Go to directorofdentistry.com/membership and claim your 60-day free trial. All the best and a successful return to your practice.